It's not going yet. How come it's not going? Give it a second. And we're live. Look at that. Look at us on time. We said we were going to go live at 11 a.m. Eastern. Rebekah Griffith, the ED DPT. I'm Jimmy McKay. Rebekah Griffith also, I feel like I need to play Hail to the Chief, also APTA Colorado president.
Yeah.
And when did you start? When does like the term start?
I started my official term as not president-elect a year ago. So I've been doing it for a year.
You've been doing it for a year?
Mm-hmm.
Good for you. Lessons you've learned? Is it what you expected and more? Or, oh my gosh, this is a lot of work. I mean, you knew it was going to be a lot of work.
Yeah, I think I did. I think one of the best lessons I've learned is that when people are really excited about something and committed to something, like working together on a project doesn't feel like work.
Totally.
So we had our an optional board meeting last night that was like hybrid online and like in person at my house, just so we could kind of put to bed our KPIs for this year. Yeah, like kind of put that to bed and then talk about what we were going to do next year. And we reviewed our successes and got to meet people's families. And I don't know, it just made me really proud of the people that I work with and so grateful for all the time that they give just to help move the profession forward. Like it's just a shared vision, it's shared goals, and like I feel very lucky to do it. So yes, it's a lot of work, but it's been really, really rewarding. And the different connections that I've made both locally and nationally have been really valuable.
You're going to cry if I let you keep going. So I'm going to cut you off with a question to keep you from crying because I know you. This is good. Crying is good though. But your job as president is to sort of steer the ship. And of course, in a good way, lots of people probably have different viewpoints. That's a good thing. Yeah. And they want the ship to go in many directions, but I'm no ship captain. Ships only go in one direction at a time anyway, for a little while. So is that more of your role now when you're president, which is like steering the ship? I would imagine. I've never been president. Oh, I was class president. I didn't really steer a whole lot. We didn't do a whole lot. We threw parties, which was great. But I mean, that's a different role for you. Although you're the president of like your family. I feel like moms are usually the president of the family. Yeah.
Well, I was also student body president of the interdisciplinary campus when I was in graduate school.
Nice.
Also as a PT. So that was interesting. I think that my role is really sort of to be the spokesman of the board.
I agree.
Like, sort of like the face of the board.
I also agree.
Comes together. And we all have discussions and we all come to agreements together on the direction the ship should go. And then my job, I feel like, is to say, this is the direction the ship is going. And here's why, because the board really speaks with one voice once decisions have been made. So I think my job is really kind of to be the voice and to build bridges outside of our organization and to help mentor leaders within the organization. So I'm not an expert at anything. I'm just sort of the one who gets to talk about it and show up at things and advocate and all of that. So I think the people steering the ship are really the people that show up to the board meetings and do the work. And then I just get to pretend like I'm the one steering the ship and tell people the direction the boat is going.
So we didn't plan on talking about this because we usually do episodes and live streams about books because you love books and I love books. I have a book to talk about. I read it very quickly because it is this many pages, but it's a great book. We'll get to it. It's a children's book, but I'll give the story. We'll get to that. So you don't have to answer any of these. I'm not trying to put you on the spot. We're friends. Yeah. But what are the big problems and KPIs that APTA Colorado is facing? Because I'm guessing those are also probably other organizations. They're probably similar, but each state is different. Like I know you have different laws and different things that you have to do in Colorado but a lot of the things are probably similar. So like, all right, let's go backwards and forwards. I'm asking a lot of questions. Let me reframe. Let's go backwards. What were some of the big successes you got to celebrate?
Well, we staved off an 8% Medicaid provider rate cut. That was
just in Colorado?
Yep, just in Colorado. That was going to impact PT, OT, and speech only. So we managed to fight that back and secure a 1.6 provider rate increase. We ended up losing the increase. The governor vetoed that, but we didn't get the cut. And that was a huge, huge win for this year. We also got rid of the Medicaid plan of care.
Hold on. Don't go past this. Yeah. Some people, I've been to the comments section before, Rebekah. Some people would be like, big whoop. APTA is going to celebrate that, but it's really you're celebrating nothing. What would your response be to, I'm going to call them the haters?
Well, I guess my response would be, would you prefer that we don't do anything?
Right.
And that you let that 8.5% cut roll through? Like, well, I mean, we're also working towards trying to find payment legislation to increase our rates, but you have to find legislators that are willing to carry that also. And that's a whole different project, and we're trying to work on that. But also the way healthcare policy is, the way government is, like right now, we're very much stuck in a reactionary environment right now. And so I'm proud of what we did. I'm proud of how hard we worked. But what I'm most proud of is how much our community came together, because 3,000 people, I think, sent letters to their state representatives.
That is not simple. Getting 3,000 people to click like on a post, you know how hard any of that is. 3,000 letters. If it takes more than 0.3 seconds, 3,000 anythings is difficult.
It was like between 2,000 and 3,000 because there were two separate campaigns, and it was to the point where like every legislator got an average of like 30 letters on this one issue, to the point where the legislators were going to our lobbyists and being like, what, tell me what's going on. And so our voices were really heard. And the coolest thing about that was PT members, non-members, PTA students, community members, patients, all sent letters. And the other cool thing was at the beginning of the year, we built an alliance with the speech therapists and the occupational therapists. But we didn't even know this was coming. And so it was perfect, because then when this legislation like popped up in the budget, we were already working together and we were prepared to work together. So we were able to share that campaign with other disciplines as well. So that was a huge win for us this year.
John says, congratulations. I don't even know where John's from. He's in Colorado. We're not. Kind of doesn't matter, because whatever you're talking about here is sort of applicable. All right. So that was one win. What was the second win? Let's talk about one more win.
We got rid of some administrative burden with Medicaid plan of care signatures, things like that. So while that seems like a small thing, it's kind of a big deal. Like anything time you can reduce administrative burden, big deal. So that was exciting. We helped our occupational therapy colleagues also get prescriptive authority for durable medical equipment. That was a win for us this year too. So those are some of our legislative wins. Other wins were we filled every open position. We reactivated 3 of our special interest groups, I think. We had successful elections. I have people emailing me asking how to get involved. At our business meeting, during the open comment section, there weren't any complaints. There were people saying, hey, we see the work that's being done. We appreciate what you're doing.
Wait, say that again. We see the work that's being done. You know where I'm going with this.
Yeah.
I think we can all improve. I'm not paid by APTA, but I'm a joiner. I like joining.
Yep.
So I like APTA and want them to do better. I am not the guy to come in and tell you what to do. Like, I'm not like the guy that we need a SIG or we need a pot. That's not me. I'm the guy who shows up and goes like, give me something to do and I'll do it.
Yeah.
But I'm the guy who does look at things in a different lens. And I look at what APTA or academies, state chapters, all of it. I don't think you need to change what you do. I mean, you that's for someone else to decide is what I'm getting at. I think you need to do that last part, which is if they see it.
I think we need to communicate loudly about what we're doing for you.
Thank you.
Because I think to a certain extent, like, I would never assume that the post office is not delivering mail just because they're not posting about it on social media.
Right, but there's mail. You see the trucks and you get mail every day.
Right. But I think that we really, truly need to share what we're doing loudly, because even if I send you an email saying what I'm doing, whether you read that or not, I just think we need to be able to, almost to the point where you can't avoid knowing what we're doing for you.
Right. Unofficial marketing gurus will say, well, let me ask you this in pop quiz. Be wrong. I would have been wrong if I did. How many times, and this is a buying decision, but membership is a buying decision. How many times does a person need to be touched or an impression or whatever by a brand before they decide to pull the trigger and buy something? How many times? What number? How many times?
Oh my gosh. 32.
I was taught 7, but that was many moons ago. Now they're saying it's around 22 to 28. So you're very close. You went on the high side.
Because I was thinking about like, how many times do I see the same Instagram ad before I finally click on it? And I'm like, okay, I do need that bag.
I will talk about this pretty often. I'm bringing up a picture. I'm not making eye contact with you. I play beer league hockey. Did you see the post that I put up the other day?
Yes.
So I play beer league hockey. I blocked a shot, and I'm putting up for the live stream audiences. My skate exploded. It just blew up. Your skate's not supposed to look like that, Rebekah. I don't know if you're a hockey fan.
Yeah.
At no point are you supposed to see your toes.
Luckily, your toes didn't explode.
To be honest, I didn't even know that the thing broke until 2 shifts later when my foot was wet from the ice. I was like, why is my foot wet? Anyway, it was then Black Friday last week. And of course, ads, right? I must have seen, and I know who I'm going to buy skates from next. Not that company. I tried them. My skate exploded. I must have seen 70 ads from Bauer. And it took me 5 days with a need. I cannot play hockey with that skate. I need it. I saw a billion ads from Bauer, right? Until I pulled the trigger and just bought skates. That's what I'm saying for chapters, academies, APTA, your local PTA, everybody. And it doesn't need to be loud or obnoxious ever. So please don't hear marketing, or I say communications because that sounds nicer. I have a degree in communications. I do not have a degree in marketing. We can get into, not for today. What's the difference?
Yeah.
I look at it just like exercise principles: frequency, intensity, time, type, volume, and progression. Yeah. That's communications. Those are exercise principles. Those are communication principles. So you could give them a very light touch, right? But people are like, you send 42 emails. I hate that. That means you're using the type of message too much. It is annoying them. Dial it back. But that takes listening to your audience and hearing how they like to communicate. If it sounds like a PT eval, it should.
Well, and we just did a survey, and it truly shows that Instagram is the preferred means of communication.
5 years from now, that might be different, because 10 years ago, I was just talking about this. We were all on Twitter. I just logged into my Twitter account for the first time in 12 months. I sort of looked around, and I just slowly was like Homer Simpson in that GIF. I just faded back, and I was like, I'm good here. I don't log
Twitter's
back in here.
Shark.
But that's not the place to be. 10 years ago, I would have said, need to be there. Now I'm saying, not so much. Right. All right. So good. Like to hear that. Good positive feedback. So that's past and a little bit of present.
Mm-hmm.
What's 20? Now we'll do we're December 1st. We're recording this. What's 2026? What are the big hairy scaries, as I call them, that you're going to work on?
Well, our state has a multi-billion-dollar deficit, and so
the state budget, you mean?
Yeah.
Your state has a multi-billion-dollar? That sounds like a lot for a state.
$5 billion, something like that. Yeah, no.
But you have ski resorts and rich people, so never mind. You could do
that. We also have no snow.
What do you mean, yet?
Yeah, we had maybe a half an inch of snow this weekend, and that's all we've had. So
you might want to get more of that.
Resorts are not resorting right now, but still come to Colorado, please. So we are anticipating cuts, like healthcare provider cuts. So we're made a legislative strategy for how we can start getting people involved now, all the way through the end of the legislative session, because like we couldn't have done that last campaign without those 3,000 voices, right? So I need to get those 3,000 voices ready to go again. We have an advocacy day planned in January as well. So I'm looking forward to that. We are running a bill to allow physical therapists to sign sports physicals for high school athletes.
Okay.
Which will be an alternative revenue stream for physical therapists who choose to do that.
Whenever someone says sports physicals, I just hear, do you know what I picture?
Mm.
Well, you're not a guy. I just every year was turn your head and cough.
It's got to be better than that, right? So we're looking to improve the care in that area. Like I took my son for his sports physical at the beginning of the school year, and I timed it. And it took 8 minutes, and that included photocopying of the paperwork time. But
this should be a layup, right? Like we should be able to do this. But it doesn't become a layup until someone like an organization like APT Colorado does.
Right. and chiropractors can do it, nurse practitioners can do it, physician assistants can do it.
Right.
And one of the bridges that I'm working on building is with other medical communities in Colorado. So I actually spoke to the chiropractors about it, and I was like, hey, this is a thing that you guys are allowed to do. We're not allowed to do that. And they were like, really? Like, they didn't even know. So we had a conversation about that, and I was like, hey, do you feel like there would be any friction between our organizations with that? And they said no. So, I'm looking forward to having.
Yeah, you can't just assume. Like, you can't just look at others and be like, oh, they suck. It's like,
so collaboration, communication, we're going to move forward with that. So really, we're on our toes. We're looking at payment legislation. I feel like we need another year to pull all of the data together for that. And also, when you go to the state in $1 billion deficit, they don't want to talk about things that cost money, right?
Correct.
So
right.
we're strategizing about that as well, but definitely trying as many options as we can, because our mission as APTA Colorado is to protect and progress physical therapy in the state.
Is that your tagline? Say it again.
Protect and progress physical therapy in the state of Colorado.
Do it one more time. I want to count the words. APTA Colorado's, is it mission, or what do you actually say? I want to mission, right?
I think so. I always get confused between mission and vision. Don't I?
Me too, and I've been doing this for 25 years. Doesn't matter. Whatever is to.
My remit is to protect and progress physical therapy in Colorado.
8 words.
That's it.
Yet I have been doing audits of APTA state chapter and academy websites, have yet to see a more succinct.
Yeah, like, I think our vision statement is much bigger than that, but my mission, my job as APTA.
You know who reads mission statements and vision statements? People who write vision statements and mission statements. Do you know who reads headlines? Lots of people. Do you know who reads bad headlines? Not a lot of people. You need to be that. It needs to fit on a bumper sticker.
Yeah.
Or a bumper sticker or a t-shirt. And if it doesn't, I'm very sorry. Like, I challenged a few people on LinkedIn with this sort of conversation in the last week, and people were posting, and I love many of the people that were posting it. And the messages they were posting are the elements, the emotions behind them are great.
Yeah.
And then did you see me commenting to these people? I said, great. Now close your laptop, wait 90 seconds, and record a video of you of saying that to me in a video. No one did it. Do you want to know why? Because they can't. Well, because it's not a headline. It's a mission.
It's not. Headline. And have you read the book 3-Word Revolution?
No, but I love it already because it's short.
Yeah. So my 3-word revolution, obviously top of scope, done. But the examples they give are like Nike, just do it.
Oh, what's my 3-word revolution? Okay, keep going. I'll figure it out.
And it's
the funny part is, hold on, before you go, it's hard to do your own. It's easier to do other people's.
Correct. Yeah. And so this book is all about like how to refine your 3-word revolution. And
this is valuable.
It's really good. And it gives lots of different examples, even like they say 3 to 4 words max. So even like Make America Great Again is like a tagline, right? It fits on a bumper sticker, it fits on a hat, just do it. All of those examples.
Look at Hillary. I'm with her, but it doesn't say it's about her, not me. Like, people like analyze that, and they told her, don't use this slogan. And she did. And look, even if you dissect that, again, not pro or anti-Hillary, but that's about her, where another tagline would be about me. Like, I need to insert, I need to be able to, she's with me is better, right?
A bit better. Yeah, totally. So it's like, what's your 3-word revolution? And so
what is yours again?
Mine's top of scope.
Top of scope. See, I like that, but we've talked about this.
I know. We're not going to agree.
That's okay. That's okay. These are good things. I look at it like top of scope is awesome. That's the top of the mountain. I think it's so high up on the mountain that people don't know what that means. Like, maybe you need one more word, like PT or physical. Maybe that would be 2 more words, because that's how words work. I don't know. We're not here. Creativity workshopping live is never good. I like 3-word revolution.
It's really good. And so our 3-word revolution basically for APTA Colorado is protect and progress physical therapy.
I like it.
Protect and progress PT. Like,
people can get behind that. They're like, what do you do? And you're like, and again, like, people around the country were like, APTA insert state here does blah, 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 blah. And I'm like, dude, I can talk fast for a long time, but I ran out of air and attention span by word 39. And no one, you can't rally behind that.
Right.
They may take our lives, but they'll never take our freedom. That's Braveheart.
Yes.
Like, If you're gonna, like people say, like the elevator pitch, I call the falling off the cliff pitch, or the about to go over the trench to attack the enemy pitch. Like, let's go. Like, God save the king or whatever, which I don't understand, but like that's a rally cry, or like,
Yeah. Well, and when you talk about, do you want to be a member of an organization, and that organization's thing is like 18 pages long, and you're like, well, I agree with this part and this part, but not that part. Protect and Progress Physical Therapy. Like, why would you not want to be part of that? If
you've given them no reason to disagree. You're like, I am for both of these things. There's probably some things I would disagree with how you're doing it, but the greater direction of the ship, I have no disagreement. Therefore, take my money.
Okay, can I give you my analogy, my boat analogy about why people should be APTA members?
I don't know if you understand how much I love analogies, but yes.
Oh no, I know you do.
But I love analogies.
And since we're talking about boats, so I feel like the boat, like every profession has a boat in the ocean. Okay. And whether people like it or not, currently the APTA is that boat.
Yes. They're the aircraft carrier. Yes. Keep going.
Whether you're a member or not, really, like, it's still steering your professional ship, whether you like it or not. Okay. So you can choose how you want to be on the boat. You can be a member and you can sit and have snacks and get to say, hey, Captain, I think we should go this way. And here's a drink. And, you've got a comfortable seat, you've got leg room, all of that. You can be like me and you can be up in the control room with an oar, like actually moving the ship in a particular direction.
Okay, got it. Keep going.
Okay. Or you can not be a member. And where do you think you're sitting? You're sitting in the water being towed by
dragging the boat.
You're being dragged. And not only are you really not comfortable, you're not having any say in the direction the profession's going, and you're kind of slowing the boat down.
Yeah.
So that's how I think of it. I think, where do you want to be on the boat? Do you want to be in the water? Do you want to be riding comfortably, or do you want to help row the boat? And I think those
can I be on the water slide?
Yeah. I mean, I think that you can be on the water slide with cocktail. Like, yes. I think that's fun.
I want to be on that. Mm-hmm. I did everything in my power not to say poop deck. See, I didn't say it.
And then you just said it.
Here's the twist. Agree with everything you say. No notes. Some people make a career by getting attention by being the person being dragged.
And that's okay.
You can't prevent that.
And no judgment, right? I think people are either members or not members for a variety of different reasons.
Agreed.
But when I think about where I would want to be, it's just, I wouldn't want to be the one in the water. Like, I want to have, I believe so passionately in our profession, I want to be the one that helps decide where it goes.
Counterpoint too, you could build your own boat, which I'm all for.
You could, absolutely.
And if you get enough people who also want to build that boat will sail. I look at it this way. Did you see here? Oh, go ahead. I cut you off.
I was just going to say, like, if you're building your own boat and you're out in the middle of the ocean, like, which boat is going to take you more safely across the ocean? Is it going to be the aircraft carrier? Or is it
yeah. But my point is, like, if someone wants to build their own boat, convincing them to get on your boat, like, just be like, hey, man, bon voyage. Look at me using boater analogies. I used an analogy on LinkedIn. I'll share the post with you. I talk a lot on LinkedIn now because I'm not on Twitter. Where I said APTA is the aircraft carrier. State chapter academies are like battleships. Mm-hmm. Bigger. I wasn't even in the Navy. My brother was, but look at me using analogies. And state chapters are like destroyers. So like where you might lack in size as a state chapter compared to the aircraft carrier, you have agility, speed. Like you have, those are not weaknesses. Those are talents and skills. They're just different. Yeah. An academy, like Ortho would be a massive battleship. It's not the aircraft carrier. It's just next to it. And the destroyer is also can do some damage. But you have other skill sets. I still think people knowing you exist is important. Otherwise, they don't know how to get on the boat or why the boat is sailing that way or why I should jump in or what it's going to do for me. That's not a selfish question.
Right.
When someone says, why should I join? What's in it for me? That is not a selfish question. That is an opportunity to get someone to try your boat out. And then here's another missed opportunity, I believe. You now have 52 weeks to overserve that person so that when re-upping comes up, it is overwhelmingly a no-brainer that I would like to stay here. I think a lot of organizations hit you up when you join, a couple times in the middle, and then, by the way, your thing's about to expire. And I'm like, that is a bad user experience. The Ritz-Carlton would never do that. It wouldn't. Peloton does not do that. Like, I think you don't need to change what you're doing. This is what a lot of people I think might have seen. Jimmy's saying change what they do. No, I'm your megaphone. I want to be a megaphone. If not me, someone, not just me. I'm not trying to like get hired. I mean, I am, but like also someone. You need you need a Rebekah. But a Rebekah needs a system at least, because you're Rebekah. You got other things like.
Well, and that's the other thing that I think at the state chapter level and at the national level that people forget is that the APTA, when we talk about the APTA this and the APTA that, the APTA is like 99% volunteer powered.
Yes, when
like
people complain about APTA, I'm like, show me one member you don't like. Point at an individual.
Right. Yeah. So it's also when you're out like volunteering your time and your effort and things like I am doing really what I can do, but like you say, like I can only do what I can do. And I think too that people just forget that the most of the people involved in the APTA are the people that are volunteering their time because they really believe passionately about the profession. And then the APTA staff are doing what the volunteers have directed them to do, right? Like there's not some corporate person in the sky that's making decisions. These are APTA members who are volunteering their time to help direct the direction of the profession. So I love that about the APTA is that it really is people that are giving their time, their talents, their passion to help move our profession forward. And I think physical therapists have that drive to make things better.
Yeah.
So, I mean, I love that about the APTA, but I think we lose sight of that. And in the comments sections, you definitely, the people in the comments sections are not treating people like they're volunteers who are giving up their time and talents.
I still look at it like you might never flip that person, you change that person, but the comments section is where I live. And I look at that person complaining and I just like take it in. I try to boil it down to the emotional whatever. Like some people are just trolls, like throw them out. And some people are super fans, throw them out. If it's a bell curve, the far left is the trolls, the far right of the bell curve. I'm not sure which way bell curves go, but the middle 70%, I think that's how bell curves work. Those are the people who are like reading, watching, listening, deciding.
Yes.
If I was a math guy, I would focus on them. Because if you can make them decide, the super fans were never going to leave you. You've been to CSM. The people who go every year, they don't even need a reason. They're just like, I don't care where it is, what the topics are, I'm coming. The far other side of the bell curve was never going to come. You could hand out $100 bills every day. They're never going to come, and they're never going to stop crapping on it. That's fine. It's fine.
And
it's the middle.
I do look at the comments because I want to look for ways we can be better.
That's the right way to use comments. It's not to try to convince someone's mind. It doesn't work.
I mean, I know that is probably definitely not going to happen in the comment section, but I do look in the comment sections for suggestions. I look in the comment sections for actionable feedback. I look for like how am I failing this person? Is it my chapter that's failing? Like
self-reflection.
Where is the breakdown coming from? And like, why is this person unhappy? And is it something I can control? And if it's not, obviously, then I try to look at the problem. If I can't fix this part of the problem, can I fix this part of the problem? So
Valid.
That's part of sports physicals, for example. Okay, I can't fix payment like this. Obviously, the APTA has been trying this for years, and there's decades worth of policy that contributes to that. But can I add a revenue stream for physical therapists in Colorado? Is it going to be a huge game changer? Maybe
listen to what a state chapter president just said. Can I add a revenue stream in my state for physical therapists? Now, hold on. Now go back. What was your mission statement again? APTA Colorado?
Protect and progress physical therapy.
Does that align?
Yes.
Great. Then that's a great mission statement. We'll just call it a headline. That's a great headline. And your strategic goals and your initiatives align. So now when your communications strategy comes out, your communications person is not suggesting what to do. That's a policy. That's a direction thing. That's your executive board hearing from the members. Your communication strategy is, how do we say this? This is what marketing is. This is how it's explained. Marketing is saying the same thing 1,000 ways, not 1,000 things the same way. I think most of the time, APTA chapters, this is where I got to do tough love. You say the same thing 1,000 ways. Yeah. I'm telling you what I did. I don't care what you did. What I care is, How does it change me? When I hear Rebekah is advocating to add a revenue stream for physical therapists in Colorado, I do not need to burn any calories or do any mental math. I understand that is for me and that is good. Even if I'm an inpatient, I'm never going to do that. I'm like, they're on it. Sounds like they understand.
Well, and I think when we talk about payment for physical therapists, it needs to be for all physical therapists. And so we're looking at that as well. Like what pieces of this problem can we solve and how can we solve them? But we need people who are creative thinkers. We need people who will not just complain about it being a problem, but help us figure out ways to fix the problem. So we've been looking at lots of different ways that we can attack different things. And some of it's even just making sure that the things that we've done are enforced. So we're looking at that too. And that's the protect piece. We've passed these things. For example, we have prescriptive authority of durable medical equipment in Colorado. But we're getting pushback from insurance companies about that. We're getting pushback from facilities about that because it's new. It hasn't been done before. There's no proof of concept yet, but it is state law. And so are you choosing to follow that? How can we facilitate this? How can we move this forward to make this better for everybody that's stuck in the system?
You didn't think this was going to be a 31-minute discussion about APTA, did you?
No, I thought we were going to talk about something like, I don't even know. I just showed up and here I am.
Here you are. All right. So what else is in the future? We mentioned one or two things. Is there anything else? Like what does success look like in December 2026 to Rebekah Griffith as the steward of APTA Colorado? What's 12 months from now look like?
When we talk about progressing the profession, I think there needs to be a massive investment in our professionals. So some of the things we're working on are like a lecture series for our early career professionals and our students to help launch them nicely. And whether that's stuff you don't get in PT school, like how to negotiate, how to interview, how to make a professional development plan, how to pay off your student loan debts, we're putting that in motion. And then again, if I can't fix payment for you, can I make you a better business owner? And can we fix like the other side of the business? So we're looking at designing something like a business improvement course for small business owners in this state specifically, because politics affects that, the insurance climate affects that, or impacts that. We're looking at, do we need to do a needs assessment of the PT availability in Colorado so we can make a case that look like we have an access issue. If we have further cuts, this is going to be a problem. So we're looking at those opportunities as well. And we're focusing on having really, really strong connections with the other professionals in our state. So we're looking to potentially build an event that would bring all of those different communities together.
Like an IRL event, like in real life with people in a room talking and looking at each other?
Yeah, and like my wild dream is that we have legislators come to a lunch where they have in that room, they have PTs, OTs, speech therapists, athletic trainers, chiropractors, PAs, MDs, like everybody there. So we can have a legislative advocacy discussion as healthcare providers.
Can I give a few pieces of advice for this event? Number one, I would like to come. Number two, that's not the advice. Number two would be, it needs a great name. That makes it real. Number two, the name cannot include conclave, symposium, summit, any of those things. It has to have snacks. You mentioned that. There needs to be food. Okay. Doesn't have to have alcohol. I am not only, that's not what I'm saying. Definitely snacks though. But yeah, please call it something cool. Conclave, summit, none of that. It's out. I'm going to a student conclave next week, I think in New Jersey. But I think I convinced APTA New Jersey to not call it a conclave. You know what conclave makes me think of?
When they elect the Pope?
No, it should. I think of witches. It sounds like coven to me. Do you know what I mean?
Yeah, I can get that.
It sounds like weird. And I'm pro-Wiccan, but not pro-witches. Do you know what I mean? I feel like witches is a negative term. Anyway, conclave sounds like coven, which sounds like, what is this? And I said to him, the guy I was talking to at APTA New Jersey, I said, conclave sounds like the oldest, crustiest word ever. And you're trying to get students to want to come to it. And I think I heard like a pause on the call. And he was like, yeah, that's not a good look. And I'm like, I don't even know what it means. I had to Google it. And I can't remember what it means. I Googled it. I still don't remember what it means. But anyway, don't call it conclave.
And then my last priority for this year is to elect the next president.
Oh, you only have 2 years?
No, it's a 4 years. So you have a president-elect year, and then
Right.
you're president by yourself for 2 years, and then you mentor somebody your last year.
Can you be the president 2 times in a row?
You can be, but I also am like looking at like leadership pipeline, bringing new people forward. Who's interested in those opportunities?
That's smart. That's
who
good.
might want to be the next voice of Colorado. So that's my next big priority for this year too, is to make sure that a year from now, I have a president-elect.
Okay. All right, good. You didn't think we were going to do a full
No, I had no idea.
APTA Colorado. Do you have a book that, well, let's switch gears. Do you have a book? Well, wait. Let's do a quick ad. We can do ads. You just had a summit.
My summit, yes.
But you're in Colorado, so I will give you a pass on summit because there's a double entendre or a pun, one of those things. You had a summit. This is the second one you've done. While we have a few earballs. What happens? Who's it for? What do they get? And then how do they get it?
So we did, it was called the Top of Scope Summit, and it was for emergency department physical therapists. And we had, I think,
22.
Now was in 2024, we had 22 speakers that talked about practice essentials and patient management essentials. And then this year was really best practice. So our keynote speaker was from Australia, and they have admission privileges, for example, in Australia.
Oh, wow. That's pretty
and do fracture management. So really talking about top of scope, what that could look like. And the presentations that we had throughout the day were amazing.
It was 2 days?
This year was 1 day. Last year was 2 days. And so those are available on demand, and you can find them at my website, the EDDPT.com.
If I want to do both, do you have a mega ticket?
Not yet, but I will.
You should.
Mm-hmm.
We used to do that a lot in radio. Live Nation. Do you guys have you guys have Live Nation venues in Colorado, right? Like Live Nation owns a lot of like most of the venues. Anyway, they would do a thing. They'd come out with their summer concert series, a few months before, and then you start picking, who am I going to go? What's the date? How much does it cost? And you're like sort of running down. And then they would always do this thing. And it was so smart. And it was like, do you want to come to all of them? It was like season tickets. And you're like, well, no, I don't like.
You want a 6-pack?
Country. Mm-hmm. But then they made the thing so valuable that you're like, you could probably resell the 3 or 4. It's like if you want season tickets to the Broncos, you're like, I know I can't go here. I got a wedding and a thing and a whatever, but you're like, it's so simple to get all of them and then parse it out. Even if I go to 6 out of the 9 home games plus preseason, it's still ROI positive.
Right.
But then they started making you buy, do you have this in Colorado? Like license, you have to buy the seat license, then you buy. This just proves my everything's a pyramid scheme. But anyway, you should have a mega ticket. That's my way of saying you should have a mega. Like if I wanted both, or are you doing this in 2026?
I think so.
Just say yes.
Yes.
Perfect. Right now, buy your ticket before March 1st. No, give it like a tighter deadline. Before February 1st, you get the last 2 years and 2026 for a price that will make your mind explode. Mega ticket. So that's the commercial. Okay. You read a lot of books. Normally we just talk about books. We just spent the first 38 minutes talking about APTA and whatever, but that's what we do. Do you want to talk about anything that you're reading lately that has lit you up? You like?
Actually, most of the books that I've read lately, I haven't been super excited about. So I want to hear about your book that you have there.
So here's the story behind the book. The book has a story. So this is a few years ago. I took a trip with someone. We went to California and we were in an Airbnb in Sausalito. Have you been to Sausalito?
No.
I'd never heard of it before. I mean, I'd heard of it before, but I didn't know where it was. It was Sausalito. I believe the official name is Sausalito by the Sea. Awesome town. Just super chill town that you walk. It's on the water. It's in California. Super nice. Anyway, we're in a schmancy Airbnb. That's the cool part about Airbnbs is you can live in like houses you would never be able to afford for a couple $100 a night. And I'm up there and there's this cool loft with 1 billion books. And I'm just up there one of the 2 nights we're there and I came across a book and I just started thumbing through it, probably because it was this big. And I like books that you can read in 9 minutes or less. It's a children's book. It is very obviously a children's book, and it even won the Independent Publisher Book Awards. It's got a medal on it. But the book is called, and now I feel like LeVar Burton, What Do You Do with an Idea? And it's very obviously a children's book. But that's the brilliance of children's books. They all have a lesson.
In 9 minutes or less.
And in 5 minutes, yes. At some point, we stop treating adults like humans with brains with attention spans, and we make PT or anything boring. How come adult PTs don't have obstacle courses?
Okay, but really, I had to take one of my kids to the children's hospital for something recently, and I was in the lobby and I was like, oh, this is so like peaceful and lovely and like
Look at that.
Why aren't adult hospitals like this?
I have another story on top of the story. I'll tell that later. I'll go back to the book. What do you do with an idea? So I started thumbing through it, and essentially there's this kid and he has an idea, and the idea, it's personified as an egg with a crown, and it walks around. And essentially, I want to, spoiler alert, if you're going to read the book, it's okay. He has an idea, and then people are like, your idea is stupid, and it's ridiculous, and ignore that idea. It's not going to make any sense. And he does. But then his idea kept following him. And then, you know what? He's like, this is my idea, and it's my idea. And I'm going to feed it good food, and I'm going to build it a nice house with no roof so it can look at the stars and grow bigger, whatever. And then eventually, the idea explodes and goes into the sky, and it becomes everywhere. And he's like, so the question, I love the fact that the book's title is a question. What do you do with an idea? Again, spoiler alert. The last page, I said spoiler alert so I can read it. And then I realized what you do with an idea. You change the world. And it's great because we all have ridiculous, stupid BHAGs. You know what BHAG is, right?
Big, hairy, audacious goal.
Big, hairy, audacious goal. You all have them. Say it again.
3-word revolution.
3-word revolution. And they're all stupid. They might be stupid to someone else, but if it's not stupid to you, give it a rip. So that is my book. I read it in 9 minutes. So anyway, I was at the Airbnb, and I might have had a couple of beers. And I was like, I don't know. I like this. So I bought it on Amazon, had a couple of beers, didn't remember buying the book on Amazon, flew home to New York, and there was a children's book. And for a hot second, I was like, what? Oh, right. Airbnb book. I got emotional. I was like, this is I don't even care what idea it is. And then I remembered. So anyway, I just found it on my bookshelf. It makes no sense, but it makes complete sense. And that is written by Kobe Yamada and illustrated by Mae Bensom. What do you do with an idea? It's great for adults, good for coffee tables, also good, I'm going to guess, for the children's.
I'm going to have to get that, I think.
My side idea, what you just said, you said you brought your kiddo to a pediatrician?
To the children's hospital.
Children's hospital. And their lobby was, or their waiting room was all, like describe.
Oh, well, they had like Lego art.
Say
and
less.
They had, right.
Say less.
And they had like, the lights looked like balloons. So it was like colorful and like softly lit. And there were like stickers, and the person at the desk was like, would you like a sticker? Like, which sticker is most important?
The answer is yes.
There was like the check-in thing, empowered children to do it themselves. So my child was able to like push all the buttons and do all the things. And then like the waiting area was comfortable. It was clean. It was colorful. It was quiet, and it wasn't scary. Like the entire experience was like friendly, accessible, calm, peaceful, colorful, and like delightful. And I was like, wow. Okay.
So this makes sense. But then at some point, and I don't know what age we are at, but we stopped doing that.
Yeah.
So the idea of the thing I wanted to share, and I'm trying to share a screen. That's why I sort of look like I'm rambling and not making eye contact with you. Here it is. Like I got a friend. His name's Chris Masters. He runs a nonprofit. It's called Man Cave Health. And it's essentially the goal is get more men tested for prostate cancer.
Love it.
We're not still at the 3-word revolution yet. I'll play golf with Chris tomorrow.
Man Cave Health is pretty good. Like
Man Cave Health is pretty good, but here's why. So if you went to your local emergency room, probably not a lot of Lego art.
No.
Probably very sterile, probably old magazine. Like we can picture every one of these.
Probably not even magazines since COVID.
So Man Cave Health does a few different things, but like their thing that you can picture, the concrete idea is they go into urology departments, and instead of a sterile waiting room, they make a man cave.
Yeah.
And this is what a man cave looks like. And this is like an artist's rendering, but it's like wood, like Ron Swanson would be behind a man cave. It's wood, leather chairs, jerseys hanging, flat screens playing ESPN, like cliches in a good way. about like what would make dudes be like, okay, this is all right. I'm all right here. Like, this is cool. This is built for me. So I'm showing you like an artist rendering of the one they built at Mount Sinai, New York. But they sat there for 5 seconds and were like, why does this look like this? This doesn't look like a guy would ever want to come here, but we want guys to come here because it's good for them. Yes, but then design it for them. Same idea around kids. You can do these same principles for adults, but we don't because I don't know, because we're lazy, because we don't think it matters. I don't know what the reason is.
Well, when I had my last kid, they had a dad's lounge that was kind of like that. It had recliners, it had a flat screen TV, it had a root beer keg. You know, it was kind of very
smart.
Cool. And it had bacon.
That's brilliant.
And my husband was like, please choose wherever you would like to give birth, but all factors being equal.
Where do you think you're going?
This one is very cool, you know. And I think too, when I go get a mammogram, which I have to do this month. Oh, okay. The only thing they make that feels like they're accommodating women is all the robes are pink. And frankly, I find that a little patronizing. And also, like, otherwise it's not really comfortable. Right. But there's so much opportunity there to make that whole experience more comfortable. Like, I would love something like that. I passed a dry bar. Yeah. I was walking to the Apple store and I passed a dry bar. Mm-hmm. And I literally saw like marble or granite countertops and light. I mean, the place is bougie, right? Yeah. Like it says, you want to hang out here and get your hair did. Mm-hmm. And then I saw what you just described. I'm walking and it's all glass. And I see what I'm assuming was like a husband or a boyfriend in a different section with couches and dudes on his phone and there's a TV. And now he doesn't care about how long does it take to get a blowout? Depends on your hair. It takes me a long time. Ballpark it for me. Are we talking about 20 minutes, an hour? Like 20 to 30 minutes. All right. But if you're going to take an hour, you're like, all right, I'll come. Well, I also think that they should make like a car place where I can get my nails done while I get an oil change. I'm thinking of the name. We could chat GPT it, but I feel like there's play on words with like mechanics and manicures. That's what I. That's 4 seconds. Let me go back to Man Cave Health. Mm-hmm. If their only thing was redoing waiting rooms at urology departments, that's further down the funnel. Someone convinced them to go to the waiting room. You're pretty much going through with whatever's happening there, right? Oh, yeah. They go away from the hospital. So Chris has no real healthcare background. Chris worked for like Adidas. I'm going to send him this episode so he'll hear. Chris is a bro. Chris is a people person. Chris is around Adidas, sports, energy, activity, business, and how to. Chris understands how to align things that organizations are like, it would be stupid for us not to do that. So Chris is like, prostate cancer affects 1 in 8 men. It affects 1 in 6 men of color. Where are the men of color? And he's like, all right, well, there's a bunch of them right over here. Where is here? A college football game on a Saturday at a historically black college or university. So what does Chris do? Chris sets up a bunch of tents in the parking lot and drops some speakers down. And now we've got environment. And he has swag of my hat, my Man Cave. I'll show you my Man Cave Health hat. I kept it. I get a lot of promo gear. I keep it and wear it because it's a cool hat. Yeah. It's a little aggressive for me to wear forwards, but I don't wear hats forwards. I wear them backwards. Now this is my hat. He has cool swag. People are walking around. They want to be invited to interact. Right. Chris wants you to say, what is that? And how do I get in there? Yep. Yeah. But what is that? I want to come over and I'm going to sniff around. I want that. That's cool. He's talking in a dude's language. And they come closer. Nothing says prostate cancer on this hat. Nothing says test. It just says cave. Many people ask me what cave means, and it opens the conversation. Because here's the thing. Prostate cancer testing used to be a rubber glove and Vaseline in an uncomfortable situation. And now it's a blood test that you can do in a parking lot at a sporting event in exchange for a cool hat or a t-shirt or whatever. So he partners with health systems and says, I'm going to be this. You do the blood thing.
And then if that person has an elevated level, you take it from there. He also builds van caves where essentially he pimps out vans with a health system and is like, great, now drive around. Like built-in sound system. This van is cool. What's that? Oh, this is what we do. So, but if he did the science thing, the first thing they would do is 1 in 8 men are afflicted of prostate cancer, and one is he doesn't do any of that. But that's proper. That's evidence-based. Yes, I will show you some evidence-based marketing studies that show you that's not how you get people to engage with you.
Yeah.
Side note, I have pushed Chris. I don't know. Try to convince. I want him. This is just my secret thing. And I've already said it to him. And he probably has better reasons why I'm wrong. I want him to say our mission is to get 1 million men tested for prostate cancer. That's what I want to say. Because that's tangible.
My mission is to have him make mammograms better.
Oh, he'll figure that out too. Right now we're on prostate cancer.
We talk all the time about transforming society, right? Like that's
a PT thing.
Correct. So, but one thing that I always say is that we can't transform society unless we go to society. So he is absolutely upstream, going directly into society, finding society, bringing society into what they need, instead of just expecting people to find us.
Correct. Chris doesn't wait to be found. If you meet Chris, this is very obvious from his personality. He knows your life story. You've shaken his hand 7 times within the first 22 minutes of meeting him. And he's constantly figuring out, how do I make you get 80% of the value and I'm just along for the ride? So you're like, if I say no to this, I'm stupid. Because he's also in the position of a long play.
Right.
Like whatever he's doing now I believe we're at year 2. He's thinking of year 12 and how next thing we do is mammograms, like in year 8. But he's going to build relationships and success. Everything I'm saying about Man Cave, you might be like, cool story about your friend, bro. If you can't take lessons from this as a physical therapist, as a destroyer, a state chapter, as an academy, a battleship, as the APTA aircraft carrier, there are elements in this that you should steal.
Well, even if you're like, I'm thinking about like vendors going to CSM. How do you get people to come into your booth?
Okay, yeah, great problem to have. Or, I mean, it's a horrible problem to have. So you're a vendor, you buy a 10 by 10 square, APTA sells you that for a couple $1,000. Mm-hmm. But now you are one of 200, 400 booths. What do you do? And what do people
stop on your Monopoly Square?
Good picture. What do people normally do? Like you mentioned at the mammogram, they just make the gown pink. So we're going to give out pens.
Yeah.
We're going to give out stress balls. Like, all right, cool. This could be a next episode because I am looking to CSM and I have a few ideas because I sat with AI for an hour and said, I need the anti-CSM Jimmy promotion strategy. If anybody else has done it, I don't want it. That's the rule. There used to be a radio station in Boston. I think it was WBCN. They would play a song until some other radio station in that market would play it. And then they're like, nope, we play new stuff. The minute someone else plays it, the minute it becomes cool, we're out, which is dangerous. You broke that song. You built it. And I think there was an extreme version of it. But so that was my prompt to AI. I'm going to promote this new thing I'm doing where I'm a digital marketing agency for APTA, state chapters, academies, and clinics, PT. This is what I do. I do these very few things for these very few people, but I do them real well. And I said, I need ridiculous. I'm willing to just short of set myself on fire.
Yeah, don't
and I don't want to just do it just to do it. And the other prompt was, if someone else has done it, I don't want to do it because I'm not copying. I don't want to do it. So I've got a few ideas for that. We could talk about that offline because, again, I want to hold my cards close because I want a little wow factor at CSM.
I need you to show up in like one of those T-Rex inflatable suits.
I have not seen someone do that. That wasn't on my list.
Funny to watch you walk around like
it is. That wasn't on my list. I'm not anti that. That might be good. I do think those are hysterical. Do you think they wouldn't be able to stop me from walking around if I had a pass, right?
Why? I mean, it's just a different kind of suit.
APTA, as far as I know in their bylaws, does not discriminate against people who are
against T-Rexes.
Against T-Rexes. All right, we're at 54 minutes. Before we start another topic that we won't be able to chew on, let's do parting shots. What are you going to wrap up with?
Choose your seat on the boat, no matter what boat we're talking about, whether that's APTA involvement, professional involvement, personal involvement. Like, you're on the boat, what seat do you want? Are you going to sit comfortably? Are you going to steer? Are you going to kind of be pulled along in the wake?
Jupiter Earth commenting, are you 8? If not, spin that baseball hat to the front. To which I will say, make me. I was a catcher, man. The only player on the field that is allowed to wear their hat backwards is the catcher. You can't do it in the field. My parting shot is, I think you do great things. I think the way to make other people see your great things is to actually put time and intention into communicating. It's simple, doesn't mean it's easy, and it's work, which is why most people are actually good at communicating. They underestimate the time it takes to do it and to do it well and to do it consistently. This is why there are marketing departments. There are also good marketing departments and bad marketing departments. Choose your heart. Rebekah Griffith, the ED DPT is your website?
Yep.
And your next summit will be announced with a mega ticket in the next 2 weeks, is my guess.
Yeah.
I don't know. If people wanted to give you $500 right now, there's no way for them to do it. So I think that is what we should focus on. That's just me. We'll be back next week. We'll talk about stuff that's completely different. And I will still, at this point, have my head on backwards. Thanks for